Yes.
Hi, thank you so much for sharing your insights so far. I'm Dario, I'm currently an engineer. So from what I've seen, a lot of MedTech, biotech solutions, a lot of times they require clinical trials, which can be time-consuming and costly. So especially for new startups in the AI space, the software space, a lot of the patents aren't really that strong, and the big players can easily overcome them. So how do you see the new startups competing with the big players, which I think it's hard to compete with, like Philips, Siemens,
Yeah. Regulation is, so the FDA, to get FDA approval, you just have to submit a form and hope that no one checks it. That's literally how it works. And CE is better. In India, you just need to know the right person. So if you have a technology, so I'll give you a very simple example. We have a startup here in Oxford. They can detect glaucoma 5 years in advance. And going to something you said earlier, the data was only 5 years old, so they actually could detect it potentially even more in advance. The liability is probably the stopping block in their introduction. Now, that data, they just went to Specsavers. Like this is being recorded, so I can't say too much about this. But you know, you can get data from many different places, and what is happening with innovation is that people are traveling to different markets in order to get access to different data. But one of the most powerful advantages to a university like Oxford is that Oxford is part of this special club that has incredible vast amount of data available to it. And the question is whether you want to give up what you want to give up in order to access that data or not. The reality is we are seeing business models like Zoe, and we talked about blood testing earlier. Like based on that, I know so anyone with a lab is thinking about how I'm just going to sell cortisol tests and figure out all this other stuff, you know. So I personally would see it as an opportunity. You have a problem you want to solve, right? Then you have another problem. This is your chance to be creative. There's always a way. Because you just have to prove it to someone. And with MedTech, it's very different to pharma. Because you're not necessarily harming the person. You know, it's the interesting thing with MedTech is like applying the pharma business model to something that fundamentally doesn't need it.